Hi everyone, this is Kathy Green, Marketing Manager with KidMed. And on this week's KidMedical message, we have Joanna Martinette to talk about ear infections. Now, Joanna, I remember when I was a kid, my mom would put cotton in my ear for an ear infection. Is that something that we typically still do?
So I actually hear that a lot from parents that they will put cotton in the child's ear to help them be a little bit more comfortable. I'm not sure how much that actually helps, but certainly whatever makes them feel better at the time is fine.
So what is the modern treatment, or what do we do now for ear infections?
So there are a couple of different things that we do. If we have a child that's come in because they're having ear pain, they've had cold symptoms, and we look and they have an ear infection, the first line treatment is antibiotics. Typically that would be something like amoxicillin, unless they have a penicillin allergy. And that would be an oral antibiotic that we would do for about 10 days. If they're in for other reasons and we happen to find an ear infection and they're not having a significant discomfort, then oftentimes we will do what's called watching and waiting. And we'll just tell mom and dad to kind of keep an eye on them, and we won't do any treatment, and we'll see if it kind of goes away on its own, because oftentimes it will resolve without any treatment.
So I know ear infections don't seem to be a seasonal thing like flu or cold. Why is that?
So there are a couple of different types of ear infections. When we talk about ear infections, there are ear infections that are in the middle ear called otitis media. That is when, say, because you have allergies or a cold or some sort of congestion, the fluid will build up behind the eardrum. The fluid sits long enough, we grow bacteria, and then sometimes we need antibiotics, and that is a middle ear infection, or otitis media. That tends to happen more in the fall and winter with cold and flu and that sort of thing. And so in that case, it can be a little bit more seasonal. And then during the summer, you'll hear about swimmer's ear, kids who've been playing in the pool or going to the beach on summer vacation, and they will also complain about ear pain, but oftentimes that infection is out in the outer ear, in the ear canal, and so that will be treated a little bit differently, typically with topical ear drops, antibiotic ear drops.
Now, is there anything as a parent we can do to prevent ear infections?
So there are a couple of things. So when we talk about swimmer's ear, obviously trying to keep the ear canal as dry as possible is really important. There are some over-the-counter preventative treatments. There are some holistic things that you can do. People will put rubbing alcohol in there to dry things out. Always cautious about putting things in the ear, but if you can actually do your best to kind of keep it as dry as possible, even using a hair dryer on the cool setting and just kind of gently blowing cool air in there will help dry it out after swimming. And so that can kind of help, or earplugs obviously is a good choice. And then a quick treatment if they do decide that, they're having some symptoms. And then as far as preventing middle ear infections, otitis media, trying to help prevent allergies with Zyrtec or Claritin on a daily basis during the seasons where they typically have allergy symptoms, preventing that congestion, preventing that drainage may help. Same thing with cold and flu. If you're doing something like a decongestant or Afrin and nasal spray, that can help sometimes. Often, also, people don't realize that when they feed their babies bottles, if you put them in a reclined position or laying down flat, that is also a risk factor for ear infection.
Oh, wow.
So not feeding your baby while they're laying down can help prevent ear infections.
Wonderful. Well, thank you very much, Joanna. I appreciate it. Once again, this is Kathy Green, Marketing Manager with KidMed. If you have anything you'd like to hear Joanna or any of our providers talk about, please shoot me an email at info@kidmedva.com.